silent depths of our bones, a hidden battle rages. Plasma cells, once soldiers of the immune system, have turned into rogue warriors, forming an insidious army of myeloma cells.
The needle prick was nothing compared to the constant ache that gnaws at my bone. It feels like there's someone squeezing a vice around my spine, especially after I move. And there's even some days that even taking a deep breath really hurts.
Multiple myeloma is a cancer that forms in the plasma cells. Plasma cells are a type of white blood cells that produces antibodies that fights infections. These mutated plasma cells, now called myeloma cells, gathers in the bone marrow, crowds out the healthy bone cells, and disrupts the immune system.
Multiple myeloma burrows into the bone, weakening its structures and leaving behind its skeletal lesion. This constant battleground can manifest in a various ways.
The fatigue hit me like a ton of bricks. I used to love hiking, but now even climbing the stairs feels like a marathon.
My infections kept coming back, one after another, and it feels like my immune system is fighting a losing battle.
My kidneys? Well, they're not happy campers. The constant worry about organ damage is just another layer of fear.
Manifestations of multiple myeloma results not only from the malignant cells themselves but also from the abnormal protein that they produce. The classic manifestation of multiple myeloma is otherwise known as the Grab features, where C stands for the hypercalcemia, R for renal dysfunction, A for anemia, and B for bone destruction. These whispers of the body shouldn't be ignored because early detection is the key in a hidden war.
Next patient.
Good morning.
Good morning. So ma'am, let us confirm first. What is your name?
Canary.
So Miss Canary, your case is multiple myeloma, right?
Yes.
So first, let us explain to you how our body or how multiple myeloma affects our body. So firstly, imagine yourself or imagine your body has a factory called bone marrow, and that bone marrow is makes a special protein called immunoglobulins. So that immunoglobulins is like our body's soldier. So our body soldier or the immunoglobulins fights off infection. But in cases of multiple myelomas, those soldiers become rogue or bad guys. So these bad guys make their own. Special protein, which is called M protein. So that M protein is not very helpful to our body because they also tell your body to build more blood vessels for them to be able to feed themselves. So by that, they are making bigger cluster of those of their group. So sometimes these bad guys leak out of the bone marrow and may spread to different parts of our body, which can hide in other places like our sinuses, in the spine, like in the soft tissues. And that hideouts is what we call plasmacytomas. So the good news here is that your bone marrow is still have a good soldiers, which makes normal immunoglobulins. So even though there might be a few of them left, so they are still working to fight off the infection. So this fighting of infection is by making the bad guys or the former bad guys become good guys again. So for them to be able to not cause more trouble and also not to spread even further. So the explanation making sense?
Yes, Buddha.
Okay, good.
Good afternoon, Doc.
Good afternoon. Ma'am, state your name.
I'm Canary.
So your case is multiple myeloma, right?
Doc, you mentioned about these raw plasma cells. Is there anything that makes someone more likely to get them?
That's a great question. While the exact cause of multiple myeloma seems a bit mysterious, there's factors that seems to increase the risk. Age is one. It is common in people over 60 years old. Family history also plays a role. Having a close relative with myeloma also increases your risk. Also, men have slightly higher risks than women, and some studies have shown it effects.
So, what about the things I do or have done, does that play a part at all?
Absolutely. Certain medical conditions such as obesity or overweight, plasma cell disease history, monoclonal gammopathy of undetermined or the MGU, and plasmacytoma can sometimes evolve into myeloma.
That's a bit worrying.
It is, but however, having a healthy lifestyle can certainly help. Managing a balanced diet, exercising regularly, and managing your stress. These are all contribute to your overall well-being and may potentially reduce the risk of various health-related issues, including myeloma.
So, thank you po, Doc.
Thank you po, Doc.
You're welcome, and knowledge is a power, folks. And knowing your risk can help us stay proactive in managing your health.
Multiple myeloma may seem daunting, but the landscape of treatment has dramatically shifted. While a cure remains elusive, we now have a powerful arsenal to manage the disease, prolong life, and most importantly, improve your quality of life. For patients with early, smoldering myeloma, watchful monitoring is the key. We'll keep a close eye on your M protein levels and intervene promptly if symptoms emerge. But for those with active disease, we have several options depending on your individual needs. Autologous stem cell transplant, where we harvest and replenish your own healthy stem cells, is often the gold standard, offering remarkable results.
Before transplant, we'll likely recommend powerful drug combinations. Proteasome inhibitors like bortezomib or monoclonal antibodies like daratumumab can significantly reduce the myeloma burden. Immunomodulatory drugs like lenalidomide join forces to attack the disease from different angles. And let us not forget about protecting your bones. Bisphosphonates like pamidronate and zoledronic acid are crucial to reducing bone pain, preventing fractures, and even potentially boosting your immune system. This is not just about drugs and machines. It is about a comprehensive approach that prioritizes your well-being and empowers you to fight back. We have dedicated support systems, cutting-edge research, and most importantly, the unwavering belief that together, we can win this battle.
Pain can be a real challenge for folks with multiple myeloma, but I'm here to tell you we have ways to manage it. Think of me as your pain detective, working alongside the doctor to find what works best for you. For mild pain, these non-steroidal anti-inflammatory drugs can be a great first line of defense, but we have to be careful with this, especially if your kidneys are already a bit under the weather. So we'll keep a close eye on things to make sure everything stays in tip-top shape. Now, sometimes the pain needs a stronger partner. That's where long-acting opioids come in. They offer a relief around the clock so you can focus on the good stuff, not the ouch. But listen closely, folks. Infection can be a sneaky visitor in multiple myeloma. So if you feel a fever creeping in, chills shaking your bones, or any other nasty change, don't hesitate to shout. Early detection is key to keeping those bugs at bay. Now, coping with this illness isn't just about pills and potions. It's about feeling heard, supported, and empowered. That's where I come in, your emotional cheerleader. We'll talk about stress, busting techniques, coping mechanisms, and ways to keep your spirit strong. Remember, you're not alone in this battle. So, if multiple myeloma has thrown you a curveball, don't you worry. We'll work together one step at a time to manage the pain, fight the infection, and most importantly, keep your smile shining bright. That's a promise.
Multiple myeloma took my strength, my hair, my normalcy, but it also ignited a fire within me. I fight for every sunrise, for every breath, for the chance to see my children to grow up. And this is my battlefield, and I will not surrender.
We may not conquer this battlefield overnight, but together we can rewrite the story of multiple myeloma. Let us fight for a future where hope prevails, where every warrior, diagnosed or not, can find the strength to face their own challenges.
Presenting multiple myeloma, because in College of Health Sciences, we care.